Please refer to a separate tutorial for examining CT brain without contrast, which is also critical. When I raise CTA head and neck, I make sure I look at the rest of the body first, the thyroid gland, the mediastinum, the lungs, and the spine. So make sure you check those. And then I look at the aortic arch and see if there's any anomalous configuration and if the origins of the arch vessels are patent. In this case, it is normal. And following that, I check the origins of the vertebral arteries, of bilateral subclavian arteries, and then I move superiorly to look at the carotid bifurcations. In this case, there's mild atomatous changes, but not causing critical stenosis. Next, I look at the cervical segments of bilateral internal carotid arteries and the cervical vertebral arteries. Make sure there's no dissection or critical stenosis. And then I move on to the intracranial vessels. I look at the ICAs bilaterally to the ICA terminus. And then I look at the circle of Willis to see if it is a conventional configuration. In this case, prominent posterior communicating arteries are present bilaterally, which is not uncommon. And then the next, I will look at to examine, say, if there is any kind of aneurysm and if the distal ACA, MCA, and distal PCAs are patent bilaterally. Next, I will move inferiorly to look at the basilar artery and bilateral vertebral artery. And to help me further increase my sensitivity and specificity, I will look at the MIP images. The most important one is the axial MIP images. It's very helpful to look at proximal vessel cutoff. In this case, it is normal. And then I also look at the distal vessels and see if there's any stenosis I couldn't see on the source images. As you can see, this is normal here. And after finishing the axial MIPs, I use the coronal MIP images to confirm some of the findings, including looking at the vertebral basilar system even better. As you can see, it gives a full-on view of the system. And the sagittal MIPs is really just good for ACAs.